2,243 people has died, and we have new 7 deaths, and also 85,922 people have recovered, while we still have 750,544 active cases in USA. And also we have the serious and the critical cases in USA is over 14,997 as at today, April 24th, 2020. Alright, welcome back on the show. Still COVID-19 updates. Coronavirus disease. COVID-19 is an infectious disease caused by a newly discovered coronavirus. Most people who fall sick with COVID-19 will experience mild to moderate symptoms and recover without special treatment. How it spreads. The virus that causes COVID-19 is mainly transmitted through droplets generated when an infected person coughs, sneezes. Those droplets are too heavy to hang in the air and quickly fall on floors or surface. You can be affected by breathing in the virus if you are within close contact of someone who has COVID-19, or by touching a contaminated surface and then your eyes, nose or mouth. Protect yourself and others around you by knowing the facts and taking appropriate precautions. Following advice provided by your local public health agency. To prevent the spread of COVID-19, clean your hands often. Use soap and water or any alcohol-based hand sanitizer. Maintain a safe distance from anyone who is coughing or sneezing. Don't touch your eyes, nose or mouth. Cover your nose and mouth with your bent elbow or a tissue when you cough or sneeze. Stay home if you feel unwell. If you have a fever, a cough, and difficult breathing, seek medical attention. And also avoiding unneeded visit to medical facilities allows healthcare system to operate more effectively, therefore protecting you and others.
A mask only works if it's put on, used and removed properly. Just follow these simple steps. Before putting it on, clean your hands. Pinch the wire at the top on the bridge of your nose, hook the elastics around your ears and make sure that your nose and mouth are well covered with no gaps. Try not to touch the mask. If you do, wash your hands straight away. When taking off your mask, remove it from behind. Don't touch the front of it and throw it away into a closed bin. Don't forget to wash your hands well straight after. Please don't use a face mask unless advised to by a healthcare professional. Never reuse a single-use mask. If your mask gets damp, replace it with a new one.
Taking you to Africa. Coronavirus outbreak, Africa cases, and some countries topping the list in Africa, topping the list of COVID-19 in Africa. In Africa generally, 27,385 confirmed cases in Africa. while we have 8,175 recovered in Africa, and we have 1,297 deaths. Now moving on to the countries that topping the list in Africa. South Africa is the number one country topping the list in South Africa of COVID-19. In South Africa, 318 confirmed cases have been added. The total confirmed cases in South Africa is 3,953, while 1,473 recovered in South Africa. We have 75 deaths in South Africa. In Egypt, 232 cases has been added, while total confirmed cases in Egypt is 3,891 cases confirmed in Egypt. 104 recovered in Egypt. 287 deaths in Egypt. 287 deaths in Egypt. In Morocco, 122 cases has been added, while the total confirmed cases in Morocco is 3,568, while 456 has been recovered in Morocco. 155 deaths in Morocco. And also in Ghana, no added cases in Ghana. No added case in Ghana. But the total confirmed cases in Ghana is 1,154. While 99 patients has been discharged. While 99 patients has been recovered. And also we have 9 deaths in Ghana. In Côte d'Ivoire, 52 cases has been added. The total confirmed cases in Côte d'Ivoire is 104, while 359 cases have been recovered in Côte d'Ivoire. 14 deaths in Côte d'Ivoire. In Nigeria, yes, 108 cases has been added, while the total confirmed cases in Nigeria is 981. 197 has been recovered, but we have 31 deaths in Nigeria. Now in Nigeria, the Center for Disease NCDC confirms 108 new cases of coronavirus. FCT Abuja confirms 14 new cases of COVID-19 as toll rises to 133. Plateau State has recorded its index case of coronavirus. In Osun, the use of face mask in public is mandatory. Oyetola. It is regrettable Muslims camps gather. Governor Seyi Makinde of Oyo State. 3 doctors test positive to COVID-19 in Lagos. Muslims told to pray at home during Ramadan. lockdown not effective. Lagos Speaker Mudasiru Obasa. South African government to relax 5-week lockdown from May 1st. 29 sentenced for marks coffee violations in Edo State. With support from our donors, WHO is able to carry out vital work on the continent. From Director General NCDC. Governor Lalong extend lockdown indefinitely in Plateau over COVID-19. And also, article urge Muslims to pray for Nigeria over COVID-19. During the Presidential Task Force press briefing, the Director General NCDC has something to say. Let's quickly join the Director General NCDC. President Buhari gets international appointment. We are running against time with no laboratories, ventilators, NCDC. Nigerian government reveals new strategy against coronavirus. Moroccans without marks in public risk jail terms. Nigerian government NLC meets over possible lockdown extension. Now sit back and relax and enjoy yourself. It's COVID-19 update coming to you from the stables of Things at 94.1 FM. And also today I would like to inform you that we will join Nicholas Muriti all the way from Kenya. He will be giving us updates on what are the situation on ground in Kenya over there. NCDC confirms 180 new cases of coronavirus. The Nigerian Center for Disease and Control NCDC on Thursday confirmed that 180 cases of coronavirus. NCDC in a tweet on its official Twitter page disclosed that the confirmed cases were as follows: 78 in Lagos, 14 in FCT Abuja, 5 in Ogun State, 4 in Gombe, 3 in Borno, 2 in Akwa Ibom, 1 in Kwara, and the other one in Plateau State. And also moving on to FCT. FCT confirms 14 new cases of COVID-19 as toll rises to 133. The Federal Capital Territory Administration FCTA has confirmed 14 new cases of COVID-19 in Abuja. Confirming the development, a tweet on the FCTA Twitter handle reads 14 new cases in the FCT. Summary of COVID-19 FCT as at 11:30 p.m. 23rd April 2020. Total number of confirmed cases is 133. Total number of active cases is 95. Total discharged patients is 35. While we have 3 deaths recorded, residents are urged to continue to stay home and stay safe. With the development, FCT has so far recorded 133 COVID-19 cases in the state. Okay, now let's join Nicholas Muriti all the way from Kenya.
Thanks so much, the COVID-19 update team on BG Bason. Okay, welcome. My name is Nicholas Muriti. I'm reporting from Kenya. The government has so far recorded 320 positive cases of coronavirus, out of which 12 persons have died of the coronavirus pandemic. Also, to our relief, we have 86 persons having fully recovered from the coronavirus disease, and they have been discharged from the isolation centers. Now, the government has been able to lay a number of measures that are meant to curb the speed at which the disease spreads in our country. Among those measures, we have a daily curfew that is subject to all citizens from 7 p.m. to 5 a.m. in the morning. Also, the government has locked down all the counties that have adversely been affected by the disease in order to prevent them spreading much further to the other counties. The government has also been able to suspend all the passenger flights into the country, and now it's only allowing the cargo flights into the country. The government is also emphasizing of proper sanitation by its citizens and wearing of masks to stumble the rate at which the spread of the disease among its citizens. The government has now laid some simple restrictions that if one fails to obey these simple rules, one is subject to a mandatory quarantine, after which the person should be judged by the court of law. And now currently the government is looking at offering some money to its citizens as an end to ease the burden of their lowered income, and for some of them to get food as they cannot afford it right now due to lack of jobs. The businesses have closed and so on. So far, the government has started taking the names of the citizens plus their bank details so that they can be able to transfer some money to their accounts to be able to sustain themselves. Okay, thank you.
Okay, thanks so much, Nicholas, all the way from Kenya. Plateau State has recorded its index case of coronavirus. This is despite being under total lockdown. This was gathered from the testing center at the National Veterinary Research Institute, VOM, in Jos South local government of the state, that the index case is a 20-year-old woman. It further gathered that the lady came into the state from Kano during the lockdown and was arrested by the COVID-19 task force in the state. However, a test result came out positive on Thursday evening, shortly after Governor Simon Lalong addressed the state, relaxing the lockdown today, Friday, to Sunday, 27th April 2020. The lockdown resumes next Monday, 28 April 2020. The governor of Osun State, Gboyega Oyetola, on Thursday announced the mandatory use of face masks in public places by residents as from April 24 as a part of measures to curb the spread of coronavirus in the state. Oyetola, in a statement by his chief press secretary Ismail Omikpidon on Thursday in Osogbo, said that the decision was part of the resolutions by the Southwest governors at its virtual meeting. The Osun State governor noted that the Southwest states were the first to make wearing of face masks mandatory, saying that the regulation would remain in place till the states were rid of the pandemic. Former People's Democratic Party (PDP) presidential candidate Atiku Abubakar has urged Muslims to use this Ramadan period to pray for Nigerians as the country tackles the COVID-19 scourge. Atiku urged Muslims to pray because COVID-19 has paralyzed the social lives of Nigerians, including the congregations for religious activities. Governor Seyi Makinde of Oyo State has expressed regrets that Muslims in the state and across the country cannot observe Ramadan the way they have been used to over the years. This is owing to the spread of the coronavirus pandemic. He, however, enjoined Muslims to extend their hands of fellowships to their fellow Muslims and non-Muslims. 3 doctors test positive to COVID-19 in Lagos State. The medical guide says 3 doctors at Alimosho General Hospital and Lagos State University Teaching Hospital, LASUT,
Ikeja had tested positive for COVID-19. Dr. Oluwajimi Sodikpo and Dr. Ismail Ajibowo, Chairman and Secretary of the Guide respectively, made this known on Thursday in Lagos on the Instagram account of the Guide. Sodikpo and Ajibowo said that the 3 doctors had been admitted at different isolation facilities in Lagos for treatment. They said that the medical conditions of the 3 members were stable and were enjoying the support of the Guide. The Guide leaders also said that the doctors at Alimosho General Hospital, Ikorodu General Hospital, Lagos General Hospital, and Lagos State University Teaching Hospital, LASUT, had been exposed to COVID-19 cases.
Niger State Governor Abubakar Sani Bello has told the Muslim faithful in the state to pray at home during the Ramadan as a result of coronavirus. Bello expressed his doubt over social distancing being achieved in the crowded places. He said for social distancing to be achieved, there would not be Ramadan lectures or people coming together to pray during the fasting period. Bello gave this advice while flagging off the commencement of the wearing of face masks in the state. He said, "We can all pray in our houses. We would have had lectures or other activities done during fasting, but if we were sure of people maintaining social distancing, but I doubt if social distancing can be maintained. So we are all to remain in our homes and pray there. The safety of our lives is the key and fundamental. Stay at home and say your prayers." The Speaker of the Lagos State House of Assembly, Mudasiru Obasa, has said that the lockdown in the state is not effective. Obasa stated this in a couple of tweets posted on Thursday. I commended the Commissioner for Health through him to the Executive Governor of Lagos State for your unrelenting efforts on COVID-19, but I must say that the lockdown is not quite effective. Can we domesticate the lockdown by involving the local government? If the lockdown will continue, it is better we move with all strategies, he wrote. Now moving on to South Africa. South Africa government to relax 5-week lockdown from May 1st.
South Africa President Cyril Ramaphosa has said a 5-week nationwide coronavirus lockdown will be slowly relaxed from May 1. Ramaphosa stated this in a televised speech on Thursday. "We have accordingly decided that beyond Thursday the 30th of April, we should begin a gradual and phased recovery. We will implement what we call a risk-adjusted strategy through which we take a deliberate and cautious approach to the easing of current lockdown restriction," he said. The lockdown began March 27, with residents only allowed to leave their homes for groceries, pharmaceuticals, and medical appointments. South Africa has Africa's highest number of coronavirus cases, with 3,953 infections and 75 deaths announced on Thursday.
Okay, now let's hear from the Director General, Nigeria Center for Disease Control, NCDC, Dr. Chikwe Inyekwezo. Sir, how is the funding of WHO is so important in overcoming the pandemic COVID-19?
The funding for WHO is so important. It's hard to really explain to someone living outside the continent how important this organization is for the work that we do. We rely on them for guidance. Lives are saved because of the work they do. We don't have the luxury on this continent to build up all the infrastructure on our own, the knowledge, the expertise that they offer. So the organization is critical to our collective survival and therefore the collective survival of the world. And a price will be paid And I hope we never get to that state. But if the funding to WHO is affected in the way it may be, there will be a huge price for humanity to pay, and not just all of us on this side of the world. So I really hope that comes to pass, and I really hope that everyone around the world comes together, support the organization, not just by speaking, but by funding it to do the critical work it does on our behalf.
President Muhammadu Buhari has been appointed the coordinator of the COVID-19 response in West Africa. This was made known by Femi Adesina. President Muhammadu Buhari spokesman Adesina said the appointment was made during a video conference on Thursday. He tweeted, "The Economic Committee of West African States, ECOWAS, leaders at an extraordinary summit held by video conference have appointed President Muhammadu Buhari as the champion to coordinate the COVID-19 response in the sub-region. All the other presidents will be available to support President Buhari." The Director General, Nigeria Center for Disease Control (NCDC), Chike Ikwezu, has said that the Presidential Task Force on COVID-19 is running against time because Nigerians want to return to normal life. He also explained that Lagos State has more testing capacity than Kano State because the first COVID-19 outbreak happened in Africa's largest commercial city. Dr. Chike on Thursday, he said, "We will be transferring some of our knowledge from state to state. We are running against time because people are pushing to live normal life. At the same time, we are confronted with the escalation phase of the figures. So how to balance these will be very difficult decision to be made in the coming week." Now let's join the NCDC boss during the Presidential Task Force on COVID-19 briefing on how he hails patriotism of frontline health workers across states.
I have just returned together with Dr. Fiona Braka, my colleague at the WHO, from a 4-day trip across 9 states of Nigeria. We started from Imo, went to Anambra, then down to Rivers, to Delta, Oyo, Ogun State, Katsina, and Kano, crossing almost all the geopolitical zones in Nigeria. The aim of this trip was really to gain a better understanding of the progress that we're making and the challenges that we face, the priorities and the issues at the subnational level in order to shape a better response. I must say the trip was eye-opening. We really saw firsthand incredible efforts being made across every state in Nigeria. In almost every state, the efforts was led directly by their excellencies, the governors. In fact, we met almost all the governors wherever we went. We met His Excellency, Governor of Imo State, Hope Uzodinma. We met Willie Obianyo, His Excellency Governor Wike in Rivers, His Excellency Governor Kowa, His Excellency Governor Makinde. We met His Excellency Dapo Abiodun, His Excellency Governor Masari, as well as His Excellency finally in Kano State, the Ganduje. So in every state they welcomed us and shared openly the challenges they faced, the opportunities, their work over the last few weeks. And this is critical because for the work that we're doing, the implementation across board depends on the actions mostly at the state level. So their leadership has been critical. Almost every state has set up some form of a task force, often led by their deputy governors themselves. So this work is really translating to effect around the states. So secondly, on healthcare partnerships, what we really saw was in every state the mobilization of private sector resources, all the partners in the states doing whatever, coming together to work around this response. So none of us is alone in this. Just like we're preparing at the national level, bringing in everyone that we have access to, the states are doing the same, converting NYSC camps in some places, IDP camps in others, and in others just putting up new tents. So using whatever resources are available to them and making sure that they're deployed for this outbreak. The other thing we tried to do was to ensure that experience is shared among the states. Some of the states like Ogun and Lagos have started very early in the campaign to respond, not in the campaign, in the outbreak to respond, obviously because they had cases earlier. Now we're trying to avoid a situation where every state is learning the same lessons the hard way. So we're trying to make sure that lessons learned in one state can be translated in the other state and be used to solve the same problems. Because across board, the problems are similar. So really, a lot of our mission was to share information, make sure that every state had the benefit of learning from other states, and therefore didn't have to solve the same problems over and over again. Of course, every state was also struggling with how to use their human resources and how to repurpose individuals doing different things. So developing staff capacity in IPC, in contact tracing, in surveillance, in managing health, managing patient safety. All these were ideas that were shared. And we saw how a lot of the guidelines that we had developed at the national level were translated into guidelines at the local level and used in the different states. Now, critically, we also saw the emergence of this state task forces on COVID-19, and the great work they're doing on resource mobilization and on supporting the EOCs that were actually involved in managing the outbreaks. And we shared information that we had learned from some states in how to improve organizational efficiency, how to take decentralized efforts, and how to make sure everybody is working together. So on return, we are going to put our thoughts together. We have started doing this together with Dr. Braca, and that will feed into some of the decisions that we made over the next weekend around the next few weeks. One thing I must say is that the entire country is in this together, and it was really gratifying to see the hopes, the energies, but also the challenges. Our country is big, complex, diverse, but across every state we visited, we saw a determination to get ahead of this curve and to make sure that we come out of it stronger. So I'll be willing to answer any questions during the session on the differences in the response in the different states, and open to any discussions further on the great work being done at the state level. I'll use the last few minutes to really say thank you to the Nigerian Air Force. Hardly have I ever been exposed to a group of Nigerians so committed to their work, absolutely punctual, humble, and dedicated to the service of our country, and I'm very grateful together with the team for the excellent service they provided to us over the past 4 days. Thank you very much.
The Secretary to the Government of the Federation, SGF, and Chairman of the Presidential Task Force, PTF, on COVID-19, Boss Mustafa, has confirmed that he meets with the President of the Nigerian Labour Congress, NLC, Comrade Ayuba. On Thursday, Mustafa revealed this during the daily press briefing by the task force in Abuja. Ayuba had written a letter to President Muhammadu Buhari warning of possible breakdown of law and order if the ongoing lockdown was extended. However, Mustafa insisted there was no threat issued by the NLC. And now let's join the Presidential Task Force coordinator denies issuing a viral statement on the possibility of a complete lockdown in the country. Let's quickly hear from the PTF coordinator, Dr. Sani Aliyu, National Coordinator PTF on COVID-19.
Good afternoon, ladies and gentlemen of the press. First of all, I would like to say that my attention has been drawn to fake task force media statements referencing turbulent times ahead, which was said to be signed by me, and talking about a proposed complete lockdown of the country. And not only is the statement patently false, it's also badly written. It is unfortunate that a small number of persons continue to engage in mischief making at such a serious time when we're talking about coronavirus infection. I must reiterate that the task force has not released any official statement on a complete lockdown. I refer to the SGF's speech yesterday on submitting formal findings to Mr. President. This is yet to happen. I request that the public and the media exercise caution in circulating or publishing unverified news. To be very clear, all formal statements on the emergency response are made through this daily press conference or through official press statements. I am asking for all parts of the media to continue to work with us to prevent the spread of divisive and harmful fake news. I would also like to applaud all those patients that have recovered from COVID-19 and are now sharing their experiences on their own volition. This step is extremely helpful in countering the wrong stigma around COVID infection. When we stigmatize persons, when we discriminate against them, when we scorn people, what happens is that they go into hiding at a time when they need help and support, and it makes our job the more difficult. We can only flatten the curve if people come out willingly to report symptoms based on the case specifications, like a fever, like a dry cough, or like shortness of breath. We need to encourage more people to come out with symptoms so that we can test them and isolate them appropriately. I'd like to remind the public that, just as the Honorable Minister of Health said, the majority of persons with coronavirus infection will get well. That in the Chinese cohort, 92% of those that had COVID recovered fully. I would also like to acknowledge the issue of the lockdown and the potential impact this might be having on people, particularly in terms of getting their daily meals, buying food, etc. The federal government recognizes this, and we are grateful for the support we continue to have and the understanding we continue to have with the public. We are working to get palliatives to the most vulnerable, and we are also working very closely with state governments to ensure that these hardships are mitigated. We ask Nigerians to please come together to overcome this adversity. Let us help our neighbors, let us help the elderly, let us help family members and friends that are less fortunate in this difficult period. Finally, I would like to talk about face masks. We would like to continue to encourage persons to wear face masks, particularly when coming out in public or interacting in closed spaces. However, it is important to remember that the use of face masks is most effective if we continue to do in combination those other measures that we know help, such as hand washing, hand disinfection, physical distancing, respiratory hygiene, and avoiding mass gatherings. Thank you.
Let's hear from the PTF coordinators. Dr. Sani Aliyu says the investigation into Kanu's death ongoing.
I would like to first of all start by informing you that the PTF continues to engage very closely with state governments. We are particularly pleased to note the decision by the Nigeria Governors Forum to restrict interstate travel. This is really important when it comes to reducing the risk of interstate spread and transmission of the virus. The Honorable Minister and the DG and CDC have already spoken about the additional support to Kano. The PTF has directed, and in line with the directive, NCDC has already redeployed at least 17 persons, including 7 from the WHO to Kano, to deal with the current issues that have arisen. In addition to this, the DG and CDC has worked with the State Emergency Operating Center to reorganize the way it functions, and a joint team together with that from the state government is currently investigating the concerns with regards to deaths. Additional lab equipments have also been sent to Kano yesterday, but the Kano lab at the moment is closed for the next few days while fumigation and disinfection is ongoing. It's extremely important that we continue to measure and stop community spread. We cannot do this without the cooperation of the public. We continue to call on the public to please restrict and stay where they are. It is important. It's a temporary sacrifice for the long-term benefit of all of us. In terms of the issue of testing, we note that some states continue to have a low level of testing for the virus. You will not have a case if you have never tested for it. We are encouraging the state emergency operating centers to actively look for cases in the community, and especially those presenting with symptoms consistent with COVID or those having unusual respiratory illnesses in the hospitals, and actively go out to test these people, because this is the only way we can interrupt transmission. And the earlier we do this, the better overall. We know that some symptoms can be quite vague, but there are classical symptoms such as a fever, which is seen in up to 90% of cases, a cough that is seen in 2/3 of cases, and a shortness of breath in about 1/3 of cases. Other unusual symptoms might include a loss of smell, what we call anosmia, which is increasingly being seen to be specific for COVID compared to other viral infections, upper respiratory viral infections. Finally, I would like to talk about Ramadan and specifically reiterate the need for Muslim faithfuls to practice all acts of ibadah and salawat within their homes as we look forward to the commencement of Ramadan, hopefully tomorrow, Friday or Saturday. We'd like to remind the public that these are unusual times, these are challenging times. They are times that we must act accordingly in order to control the spread of the virus. As we're seeing Ramadan tomorrow, we need to make sure that we protect ourselves so that we are around next year to observe another Ramadan.